Hey everyone, welcome back to the Npte podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today I've got a practice question for you I think you'll enjoy. But before we get to that, just a quick reminder, in this podcast, we're going through all of the FSBPT's content outline. Plus, I just had a question come across about the neuromuscular nervous system, so I couldn't help but share it with you, so I hope you enjoy this. So on test day, you can expect somewhere between 39 and 48 questions on the exam related to the neuromuscular nervous system. So this is going to cover really the entirety of the life cycle, or the life, what is it? How does it put across the lifespan? That's how they put it on the FSBPT's content outline. I also wanted to mention that as we're getting going here, at the very end of today's episode, I'll mention our best deal of the year. You're not going to want to miss this. This is our Black Friday deal coming up. So those of you who are listening to this during our Black Friday week, I think you'll really enjoy it. So be sure to stick around for our Black Friday deal. Best deal of the year. You're definitely going to want to take advantage of this while it's there. All right, so let's go ahead and talk about this practice question for today. As per our usual, I will read to you the question, give you a moment to respond, and then we'll talk about it together. Here we go. If a patient with a traumatic brain injury is exhibiting aggressive behavior, which of the following intervention strategies will be most appropriate? So again, if a patient with a traumatic brain injury is exhibiting aggressive behavior, which of the following intervention strategies will be most appropriate? 1, do not use physical force or do not respond with physical force. 2, identify motivators and use positive reinforcement. 3, provide verbal cues for safety throughout the task. Or 4, review consequences of unsafe movements. So again, if a patient with a traumatic brain injury is exhibiting aggressive behavior, which of the following intervention strategies will be most appropriate? 1, do not respond with physical force. 2, identify motivators and use positive reinforcement. 3, provide verbal cues for safety throughout the task. And 4, review consequences of unsafe movements. So chances are, if you've worked with this population at all, you've probably encountered this with patients that they've had aggressive behavior. So when it comes to aggressive behavior, the most important thing is to not respond with any physical force. This is because really this is true in pretty much every instance, but like in manual muscle testing, we respond to a load or a force placed upon us. And so if you use physical force, they'll want to use physical force back. So aggressive behavior only escalates with physical force. The only exceptional case would be if they're about to fall off the stairwell or run out into traffic or something, then you might consider using physical force, or to, the safety of others, whatever it is. There might be some remote possibility that you would use that. However, in the case we're treating a patient and they've got a TBI, chances are the best thing to do is to stay calm, try to reduce stimulations, keep a safe distance, avoid physical force, all of this in an effort to try to calm or talk the patient down. So using or responding with a physical force would typically, you would never, almost never use that. So it would be most appropriate to not respond with physical force. These other answer options: identify motivators and use positive reinforcement. So this is all about if someone has some type of non-compliant behavior or refusal to participate. This would be in the case that, they just say no to everything. Do you want to walk to the bed, or walk to the doorway of the bedroom, or do you want to walk down the hallway? You give them a choice, but chances are if they refuse, then it's possible that you may need to use some other motivation. Like, hey, I saw this beautiful, there's a beautiful tree outside. Whatever it is you want to use, some type of positive reinforcement. Like, hey, if we walk to the window, we'll be able to see that. Or if you participate in this activity, then we can participate in this other fun activity. Like in our clinic, we had a laser pointer. That was just so much fun to use, like a little laser pointer or some type of light up interactive device. That type of positive reinforcement can be very helpful to motivate or get a non-compliant patient to participate. Providing verbal cues for safety throughout the task, that would be best for someone who's impulsive. And the same thing with reviewing consequences of unsafe movements. This would be for the patient who lacks self-awareness and has significant impulsivity. So you'd want to provide verbal cues throughout and review consequences of unsafe movements, trying to help them understand what like I said, the consequences of their actions would be. So there are actually loads and loads of these intervention strategies for someone with a TBI. Umfred describes this pretty significantly in neurological rehabilitation. I'll also try to include the notes. Those of you who are watching on YouTube, I'll try to include as many notes as I can. But in any case, for someone who has a TBI and has aggressive behavior, you'll want to use a reduction in stimulation, try to stay calm, avoid physical force, and keep a safe distance. But again, trying to keep an eye on the patient and just reducing stimulation and have a calming influence on the patient is your very best bet. So there you go. I wanted to make sure that I went through that one. That was a great question that I felt like it was good to review with regards to traumatic brain injury. Now I want to just talk briefly about the Black Friday deals that we've got going on. So Black Friday, this is the biggest sale of the year. You definitely want to take advantage of this. If you're planning on using any of our material anytime, this is the time. It's an extremely limited window. So if you're, the primary use of this product is to get you ready for the Npte. So our independent study course, all of our recorded material, self-paced material, comes with practice exams, has a 12-month access. So if you're testing at all in 2025, you will want to take advantage of our independent study course. If you don't need the full independent study course, which has all the video modules, all the written material, all the practice exams, all of it put together, then you may enjoy just getting our practice exams. Our practice exams are also on sale. This is, what do we have it for? Over half off. So it's more than 50% off. It's an extremely limited time though. So as you're listening to this, by the time we hit Black Friday, that is the end of this deal. You'll definitely want to take advantage of it while it's here. Also, when, I guess as I think about all the benefits of this, the 12-month access window, that's key. So if you're testing in 2025, there's really kind of a no-brainer to make sure that you take advantage of all the material. The practice exams, that's a huge one because the independent study course comes with practice exams. Essentially, I'm giving you the whole independent study course for the price of the exams. So you're getting all of the written material, all the video material, the recorded material, all of that, plus the practice exams, the exam simulator. Everything is there for you. So you'll definitely want to take advantage of that for the Black Friday deal. So that's our deal. If you haven't yet, be sure to sign up over at ptfinalexam.com/podcast to be the first on the list for this deal and to take advantage of all the other material that we've got. You can find everything at ptfinalexam.com. If you haven't yet, be sure to leave us a like, 5-star review, whatever it is. Help us get the word out and pass this podcast along. And in the meantime, hope you take good care of yourselves. Have a fabulous Thanksgiving weekend, and I'll catch you all on the other side. Thanks, everyone.